Great, thanks, Tim. I only have a couple of slides left, and actually there's a question that I want to go ahead and field now. So one of our attendees asked, one of our biggest challenges in healthcare is the lack of interoperability across the continuum. More technology, different systems which do not communicate, from telehealth to urgent care to hospital to physician office. How are you integrating into one patient record? So I think that's a good lead-in. I just wanted to spend a few seconds on how we are trying to address inter-organization team communication in a telehealth solution. So at Pulsara, instead of opening up all of these different communication channels that you see, what we do is we create one single dedicated patient channel. So this can be started anywhere at any location. Step two is you dynamically build your care team on the fly. And what that means is you can add a new healthcare organization with a tap. Within an organization, you can add a team or an individual. And then step three is you can leverage that as your telehealth network and then basically communicate. So that means live audio, live video, but there's also things like messaging, ETA, images, audio clips, other multimedia vendor integrations, data repository integrations, those type of things. So when you look at that from an organization perspective, I think it's kind of important to look at, well, okay, how do you patch a system together within a metro area or within a rural area? So any organization can start a case. They can involve internal care team members. They can even use our patient-facing app and involve the patient into that red line, into that patient channel. And so just within an organization, you can leverage Pulsara. But at any point, if you want to consult or transfer to another organization, so I just need your opinion, or I need to transfer ownership, you just add that organization in with a tap, who can also add their internal care team members, patient or family. Together they can have the interaction and stop it, or they can just keep adding and keep adding and keep adding organizations. And so that's how basically we are able to pull everybody together. I think how do you sell, who's the client, who buys something like this kind of comes into that, because people aren't used to regions being consolidating it down around one thing. And so I think it's important to look at, we have EMS agencies, we have hospitals and healthcare facilities, and we have a MedOps package that's targeted at emergency management or state-based transfer systems or regional systems that are either command and control or a communication and collaboration mindset for selecting destination. So we have free and paid versions on the EMS and hospital end, so we can unite the entire country, replace the traditional radio report or hear report with a multimedia report, including ECG transmission, and that's free to EMS and free to hospitals. If EMS wants to upgrade for select services, they can. If hospitals want to involve downstream team members, they can choose to upgrade as well. Other things is all referral facilities, nursing homes, urgent cares, some of the other places, physicians' offices that were listed in the question, they can join at no charge and use to live audio, live video to transfer patients. So I think those are some good ways, and of course the MedOps package can come in and overlay and help regions. So one of the key things is we can mix and match these packages into bundles. And the final comment out there is we are obviously in dire financial straits as a healthcare industry. We're all struggling with elective procedures being delayed, postponed, stopped altogether. One of the things that I think is important is there are tons of grant and funding opportunities. We've actually identified not hundreds of millions, but billions of dollars that can be used to help regions band together. And so we can help you from an individual EMS agency or hospital or health system, or work with larger groups such as metro areas, regions, RACs, all the way up to states to put together a package that makes sense for you. So with that, I do want to read a few of the things that people are thankful for. So one of the things that is kind of a resounding theme on a lot of the feedback from the audience is spending time with family. So meals and with family for sure, chance to be aware of every blessing. My favorite family-related comment is actually getting my 17-year-old to choose to spend time with me. #priceless. So some of the other things I think that are great are being able to slow down and focus on what really matters. Another one said it this way: I'm thankful for the slower pace, less going and doing, and more just being. I'll close these comments, or actually I'll do two more. One is telehealth, more comfort with innovation in transforming systems and local and regional networks actually working together, not always competitors. And I'll close with Matthew. Matthew, I won't disclose where you work, but his was not wearing pants. So with that, I will hand it back over to Brian.
Thank you so much, James and Tim, for that excellent and incredibly timely presentation. And thanks to all our attendees for sharing those positive vibes. We definitely appreciate that. And we will now begin today's question and answer session. So please submit any questions you have by typing them into the Q&A box you see on your dashboard, and we will get through as many as we can. We've had a bunch of great questions come in already. The first one we'll kick it off with is the attendee writes, telehealth was conceived to solve a lot of problems. A language barrier is not one of them. Are telehealth providers doing enough to address the need for integrated language assistance for deaf or limited English-speaking patients? What more can be done to ensure compliance with the law as it relates to language access?
Yeah, great question. I can kick that off. So there are more and more people leveraging mobile technology where translation services are local on the device and therefore secure. There are also dedicated services. It's one of the main reasons why we were focusing on the ability to dynamically build your team on the fly, and that can include anybody. And so there are a lot of services that are out there that do provide that. And so with a tool like Pulsara with flexible interactions, you can bring them in as a care team member, and they can help from a group interaction standpoint provide some of those services. So those are a couple of ways, and I think that is an area that's ripe for disruption as well.
Thank you for highlighting those tools and those services. And the next question I have here, I believe, is an attendee asking for a clarification on a comment from Tim. So did Tim say only audio appointments are accepted for CMS, no video?
No, that's not correct. It's audio and video. The difference is the audio side is being accepted now during the pandemic, and those are billable services during the pandemic. It'll be interesting to see how that plays out going into the future, but it is audio and video, to answer the question specifically.
Thank you so much for clearing that up, adding some clarification there. The next question we'll take, and we've had a bunch of great ones come in. Really appreciate all this great engagement. So the next one is, what potential do you see during and beyond the pandemic to use telehealth to incorporate primary care providers into inpatient roundups? For example, primary care joining via telehealth for consultations with hospitalists or surgeons when their patient is in the hospital to improve continuity of care and strengthen referring provider relationships.
Yeah, I can comment on that one. So there's two different components to that question. One is the technology. I think the technology exists to basically pull in a clinician for rounds. And that's probably a lot, especially in-system providers. They can leverage solutions that they probably already have to do that. Solutions like ours are able to do that even outside, bringing in non-primary or non-affiliated providers. However, I think schedules and protocols and procedures as far as timing on those, as you know, those are often very difficult to align best case scenario. and rounds often go late, and actually scheduling those and disrupting clinic is probably going to be one of the primary challenges for them to join synchronously. I think there's massive opportunity to involve them with asynchronous communication and tools.
Thank you so much for tackling that, James. The next question we'll roll into is, the attendee asks, how are organizations handling the relaxation of state regulations allowing out-of-state providers to treat patients with 1135 waivers? What does this communication plan look like, and what controls are in place to ensure providers are complying?
Sure. Tim, do you want to take first pass at that?
Yeah, I can. That's a very good question, and I really, it's going to be interesting to see how this really plays out. I think time is going to tell how it's going to end up post-pandemic, and I think that's really what the question is focusing on. And the state waivers and crossing borders and all of those kind of things are still up in the air, and how that's going to happen, especially beyond CMS, and how the parity for other payers is going to handle that. So other than to say at a high level, I think we're going to have to watch and keep an eye on that specific thing. I haven't seen anything that really explains that in detail.
And I haven't seen where people are talking about that being something that is going to be persisting as well. So I haven't heard a lot of chatter about that. Great question.
Yeah, it is a great question.
Appreciate you both, weighing in there and offering some added clarity there. So we are almost at time. So we'll do one more question, and I'll invite Tim, James, any closing comments for our audience. You can make those at this time as well. So the last question we'll go with here is Pulsara compatible with Epic and its App Orchard for wound care telehealth?
So high level, go ahead, Tim.
Go. Okay, sorry. So at a real high level, we do have integrations, capabilities to all of the major providers, Epic, Cerner, Allscripts, and so on. Specifically as it relates to wound management, we haven't necessarily gone down that avenue yet today, but we do have the ability to move our information from our solution into the different EHR solutions that are out there.
Well, appreciate you both for tackling all those questions, and thank you to all our attendees for being so engaged and asking such thoughtful and detailed questions. So James and Tim, that was a great presentation. Thank you so much, and I want to thank Pulsara as well for sponsoring today's webinar. So enjoy the rest of your day, everyone, and we look forward to having you join us for future webinars.